and welcome to the Good Health Show, your weekly look at the biggest health stories from Mail Plus, along with all the latest tips and updates to keep you and your family safe and well. I'm Amelia Hemphill. Coming up on today's show, it's Organ Donor Week. The laws on donation were updated back in May, but how does that affect you, and how can you start those difficult conversations with your family about future planning? The tragic death of film icon and Black Panther star Chadwick Boseman, aged just 43, has raised awareness about the threat of bowel cancer. But should you be booking yourself in for a screening? And a new school year can mark a fresh start for all of us, not just the kids. Jordan Cox will be here to tell us how we can get fit and healthy on a budget. But first, on Sunday in the UK, there were 2,988 new reported cases of COVID-19. That's the highest daily total since May the 23rd, when the country was still in lockdown. But the number of new deaths is only 2, which brings us to ask, what is the current state of play with COVID across the UK? Well, Dr. Alka Patel, nearly 3,000 new cases, that's quite a number, but not many deaths.
Absolutely. I think it's a tricky correlation to make, really, correlating deaths and cases. And this can be a number of reasons for this, really. I think we have to look at the age cohort of people being currently affected. I suspect it's the younger cohort now as well that's being affected. We know that mortality is higher in the older generation, in those with pre-existing health conditions, comorbidities. And so I think this is probably the emerging information we have now in terms of data is more related to that younger generation perhaps being affected more.
So do you think this means we don't need to worry about COVID-19 anymore?
I would love to say yes, but I'm going to say no.
Unfortunately not.
Yes, I think being mindful rather than being worried is probably a bit more appropriate stance to take. I think we still need to have awareness around us. I don't think fear is the best emotion, doesn't always let us make the most appropriate decisions, but certainly we still need to be very mindful of COVID existing in our lives for sure.
But what we have noticed is that there's a big difference in the infection rate around the country. Do we know why this is?
Again, let's think about what's sort of happening around the country at the moment. People certainly are starting to go back to work, and that may well be playing a part, particularly looking at areas where workforces such as construction workers are going back to work. There are sort of seem to be pockets of infection related to that. Are people getting more back on public transport more as well? Certainly there will be some correlation related to that as well.
Yeah, as you said, it's the start of a new school year. Everyone's being encouraged to get back into the office. This does seem like quite a big change. Do you think we're moving too quickly when the numbers of infections are going up again?
Yeah, I think we've sort of done this all or nothing thing, haven't we? We've said sort of all out in March, out of schools, off public transport. So the sort of message about public transport was quite strong then. And come September, we've said all in, back onto transport, back into schools. So I think that sort of my personal view is really we probably are doing things more quickly than we should, certainly from a health angle.
And can we talk a little bit more about public transport? Because we're being told it's safe, everyone's wearing masks, get back on the tube. Do you think this is going to be one of the big reasons for a spike in cases again?
I think genuinely, Amelia, I don't think we have enough data or information about transport per se. Certainly there's emerging data from the US and from Japan where there doesn't seem to be a correlation in terms of numbers increasing being linked directly to the use of transport. There was some research done, I think, a couple of years ago, 2018, at University College, Dr. Lara, and of course wasn't looking at COVID then, but certainly looking at influenza and flu-like illnesses. And there was a correlation between the use of public transport and particularly the tube and infection rates. Now, obviously, correlation doesn't equal causation, but this is important data to bear in mind, and I think we really need to have a bit more research in this area.
Thank you very much, Alka. Lots more to talk about during the show. Well, across the UK, over 4,000 people are currently on an organ donor wait list, leaving families and patients of all ages waiting to hear if they're going to get access to life-saving treatment. Each September, the NHS devotes a week to spreading awareness about what organ donation entails. It's something that Karen Piotra knows all too well. When her husband Mark passed away, she made the decision to donate his organs. And Karen joins us now. Thanks for joining us. Will you tell us a little bit more about your husband, Mark?
Hi, good afternoon. Yes. Mark was 47, and up until the point in May 2017, he'd been fit and healthy and full of life. And he was a very selfless man, you know, he was very caring and compassionate. And just before he suddenly passed away, he'd had a few headaches. And we were taken to intensive care one night, and he'd gone into an induced coma. Not a very nice feeling, you know, there's lots of emotions going around there that you can see your husband of nearly 30 years in this state with wires everywhere. And then we were taken across to a different hospital, and he was operated on, and he had what they called a spontaneous brain bleed. And he's hooked up to a life support machine in intensive care. Not a very nice image to have. And then I was faced with the daunting task of having to make that decision in the life machine.
I'm so sorry, what a terrible time for you both. And was organ donation something that you'd spoken about with Mark?
Yes, it was. We'd regularly given blood, and on the way home we used to comment, they've had a pint of our Yorkshire finest, and if anything ever happened, we're on the donor list, and please don't hesitate to honour my wishes. So when I was faced with that decision, it's not an easy decision to have to make by any means, but it certainly made it a little bit easier because I knew what Mark would have wanted in that instance, and I was very happy to honour his wishes as his next kin.
And once you'd spoken to the hospital about the process, how were they about keeping you up to date with what was going on and answering all your questions? I'm sure you had a lot of questions.
You're allocated what they call a specialist nurse organ donation, very kind, caring man. He spoke to me, he didn't make me feel pressured or rushed. He answered any questions I may have. And the next morning when he'd done all his tests and everything had been sorted out, he rang me, tell me the procedures were taking place, the organ donation retrieval operations were taking place. And then he rang me later on at tea time to tell me that they'd finished and that Mark was on his way to the mortuary. And then a couple of weeks later, I had a letter from the NHS BT, and it detailed where Mark's major organs had gone. Now, how amazing, really, to think that there was a 19-year-old boy got Mark's heart, and I still find that very precious today. But most of the people were in their 50s, so like the lungs, the liver, the kidneys, the pancreas and the small bowel. So quite an amazing letter to get to tell you where your decision for Mark to be an organ donor, where his organs had gone.
Wow, how amazing. And unusually, you actually got to meet two of the recipients of Mark's organs, didn't you?
Yes, I did. And again, how amazing and special. It doesn't happen all the time because many donor families or many recipients don't want to get into correspondence, and it's all anonymous. But yes, I did start corresponding with the man who has Mark's liver and also the man who has one of Mark's kidneys. And I've been very fortunate to meet both men. The man who has Mark's liver is now a granddad twice over. And then the man in his 30s who got one of Mark's kidneys got married last year, and he wore a rather lovely tribute on the inside of his wedding jacket, just thanking Mark for that amazing gift of life. So how fantastic is that?
That is so amazing, how incredible. And you now act as an advocate for organ donation. What advice do you give people about having these conversations? Because they are such difficult conversations at a really vulnerable time.
They are. Now, whatever your feelings are about organ donation, I would certainly say and try to encourage people this week to have that conversation with your family, your nearest and dearest, and just let them know what your organ donation decision is. One life can save up to or improve those of 9 others. What an incredible legacy of life that certainly is.
Karen, thank you so much for joining us today.
Thank you very much for having me.
During lockdown, the laws on organ donation in England were actually updated. And with all the coronavirus news going on, this could have been an easy one to miss. Well, Claire Willamant is the head of law change implementation at NHS Blood and Transplant, and she's with us now to help explain exactly what's changed. Well, Claire, thank you very much for joining us. What is the update for this law which went through in May?
So The new law that came in May means that all adults living in England will be considered as organ donors unless they've opted out of organ donation or they're in one of the excluded groups. So, for example, if you're a member of the armed forces, or if you're a visitor to the UK, if you're here as a tourist rather than living here ordinarily.
And what about people's own preferences? Will they now be ignored?
Not at all. So we know that most people do support organ donation, and it's a very personal decision. So it is still very much, even though the law has changed, an individual's decision. So what we're asking everybody to do is make their decision about organ donation, record that decision about organ donation on the NHS Organ Donor Register. It takes 2 minutes of your time, organdonation.nhs.uk, and then tell your family, tell your friends, tell your loved ones what you want to happen, because we'll always still consult the Organ Donor Register and speak to the friends and families as well. So it's really important that you have that conversation so that they know what you would have wanted.
How would you recommend people go about doing it, speaking to their loved ones about these issues?
Well, it's organ donation this week, so you should hopefully be seeing things, and that might help you prompt a bit of a conversation. But also, if you go onto the Organ Donor Register and you record your decision, you'll see at the end of it, there's an option for sharing news and sharing your decision on social media, and that can be a useful prompt as well. Or just, 5 minutes over a cup of tea. Or do you know what I did today? I signed onto the Organ Donor Register. What about you? Just get that conversation going, because it is difficult, but let's use this time during Organ Donation Week as just a prompt to start having those conversations, because it really is very, very important to have those conversations.
And as you said, Claire, we know that organ donation can often come into conflict with these cultural sensitivities or with religious beliefs, and this has actually led to a real shortage in diversity of organs. Why is that such a serious problem?
Because people from Black and Asian communities are much more likely to have sort of genetic tendencies that mean that they sadly have conditions that lead to organ failure. That means that you're much more likely to need an organ transplant later on if you're from Black or Asian populations. But traditionally and historically, people from those populations haven't agreed to donate. And that means, because we have to do very, very close matching between an organ and the recipient, that people that are from Black or Asian populations wait much, much longer for a transplant. And it just means that sadly there aren't enough, it's even worse for people in those populations. So we would really ask people to think about it, make your decisions. If you've got any concerns, want any more information, there's a lot of information on our website, and speak to your faith leaders, anybody else, about what organ donation involves, so that people can make the decision that's right for them.
Thank you so much, Claire. Some really important points there. Alka, organ donation, it's such a lifeline for people. Is this something that you find people and patients are very well informed about, or maybe something that they've overlooked?
To be honest, I'm thinking about my 20-year career, and nobody, not a single patient, has come forward to me to say, can I have a chat with you about organ donation? So we do discuss it. I know, we discuss it, but we discuss it at the end of life. We discuss it as part of palliative care conversations, but not proactively. And I think there's probably a couple of reasons for that, really. I mean, fear obviously does sort of play a bit of a part in their difficult conversations, as you said, and we find them hard to raise. I think awareness a little bit, as we sort of alluded to earlier. People know that organ donation exists, but there's still a bit of mysticism about it. And I think there's probably also a bit of self-denial about life, and if there's a beginning, there's got to be an end, and it's not the sort of things we want to talk about. We spend so much time talking about, don't we, pregnancy and preparing, and talking about our wants for our babies and cots and pushchairs and feeding and sleeping, but we don't do the same for the end of our lives at all.
And you're always having to have these difficult conversations to raise things with people that maybe they don't want to talk about. How would you recommend people start having these difficult conversations?
I think it's trying to make the difficult more ordinary, lightening up these conversations. And even with children, we know the law was changed on the back of Max and Kira's story, which is certainly on the sort of organ donation website, and Max was 9 years old, I think. And so having these conversations early with children is also really useful. When they come home with their drawings with those beautiful hearts on them, there's an opportunity to have a chat. When your teenage child is learning about organs in biology, shift that conversation. So there is lots of opportunity for those conversations. And also with our sort of elderly relatives as well, who can obviously sort of find things a little bit more difficult to chat about.
Thank you, Alka. Well, last week, the world was shocked by the passing of movie icon Chadwick Boseman. Boseman inspired millions in his role as Black Panther in the Marvel franchise, and he was just 43 years old. While he kept his colon cancer diagnosis private for most of his illness, his deaths raised awareness about the dangers of colon cancer and the importance of screening. Genevieve Edwards is the Chief Executive of Bowel Cancer UK, and she joins us now on Skype. Bowel and colon cancer don't really get talked about that much. What kind of symptoms are we looking for here?
Well, you're right. Knowing the symptoms could save your life. And there are some really simple red flag ones. The main one being if you have any kind of bleeding from your bottom or blood in your poo. Other symptoms are a lump or pain in your tummy, just tiredness that you can't explain, persistent tiredness, or sudden weight loss. Now, if any of those things happen, then you really do need to speak to your GP, including keep an eye on your bowel habits, because if they've changed as well, that's another important symptom. So make a note of these, and if particularly bleeding, go and see your doctor straight away.
And catching any kind of cancer early is always so important for your recovery, isn't it? And what kind of screening is there available for bowel cancer?
So the screening for bowel cancer is a really important and valuable thing, because if bowel cancer is actually preventable. So if the NHS invites you to take a screen at home, and it's a simple test called the FIT test, looks for traces of blood in your poo. And it's really easy to do, and you send it back. You do it every couple of years. And if you get the chance to do it, please do it, because if it's detected really early, most people will survive bowel cancer. But the truth is, for too many people are diagnosed late when it's much harder to treat and your outcome is much worse. And that's why, although it's the fourth most common cancer in the UK, it's the second biggest cancer killer. So screening is super important to do.
And then, of course, during lockdown, a lot of people have been avoiding screenings. We've been hearing about backlogs at hospitals. What kind of advice would you give to people?
Well, you're right. Screening was paused in all 4 nations in the UK during lockdown, and there were well over 1 million missed opportunities there to diagnose bowel cancer early. So that's why it's so important to be really vigilant about the symptoms, because if you get any of them, don't delay. And our recent survey of younger people with bowel cancer showed that 1/3 of them delayed for several months before going to the GP. Now, I don't know whether that's because some people think they can't get bowel cancer young, or whether you're not even aware that it's a symptom, or perhaps just embarrassed to talk about what, let's face it, is our digestive system. But I know that some people do struggle with talking about it. But really, your GP has seen it all, heard it all, and really wants you to come and talk about those symptoms. When you look at the numbers of people who are being referred by GPs, it plummeted during lockdown. People just didn't go to their doctor, and I know they didn't want to bother them, but the GP really does want to see you if you've got these symptoms.
And Chadwick Boseman was only 43. Is that normal?
It was tragic to hear about Chadwick Boseman, and his work was an inspiration to so many people. Bowel cancer does largely affect older people over the age of 50, so it is rare in the under 50s. But that said, there's still 2,500 younger people every year diagnosed with it. And that's more than the total number of people diagnosed with cervical cancer, for example. So it's a significant number. And that's why we're really keen to make sure that younger people in particular are specific with their GPs about their symptoms, because for the majority of them, it will be something else. But for those 2,500, the quicker they're diagnosed, the more likely they are to survive.
Thank you so much, Genevieve.
Thank you.
Well, Alka, it's always so terrible and tragic when anyone gets a diagnosis of bad news. What do you think about celebrities sharing their medical diagnoses? Do you think that really raises a lot of awareness in the public?
Oh, absolutely. So, certainly Chadwick this weekend was a real sort of topic of conversation in our home, and certainly celebrities do that. Sarah Harding recently disclosed her breast cancer. That's increased sort of awareness. I remember Jade Goody from a number of years ago, back in 2008, and the cervical.
She was seminal for cervical cancer, wasn't she?
Absolutely, and the upshot of that really was that the cervical screening rates, the sort of screening rates increased phenomenally. I think over 400,000 women came forward for screening. Sadly, those rates have declined again. So it really does show how powerful sort of celebrities can be in terms of sort of influencing and inspiring with their own stories.
And Genevieve was telling us about a lot of the symptoms there. Some of those feel like they could apply to a lot of conditions. How can patients really communicate clearly with their doctor if they're concerned about this?
So probably a couple of things there. I think the first thing is to tell your doctor everything rather than holding back any of your concerns.
Don't be worried about the overshare.
No, absolutely, because I think it's part of your story and really important to express why you're worried. So if you've noticed bleeding from your bottom in your stool, tell your doctor that it's because your grandfather had bowel cancer and you're worried about bowel cancer, because all of that helps us just to piece together the information and make the sort of right forward moves for you. I think the second thing is also things can change. So if you've noticed bleeding and actually it's been okay, but then you start losing your appetite and quite pinpoint why, go back and share that information, because certainly things can change. And I think the other thing is not to put a pun on it, but trust your gut instinct.
Yep.
Really.
Trusting your gut.
Absolutely.
Won't send you in the wrong direction, hopefully. Well, the start of September means back to school again, and for most pupils, the holidays have been a lot longer than usual due to COVID. The government's hoping that schools will be able to stay open during any future lockdowns, now that new social distancing regulations have been put in place. But that doesn't mean it's all going to be back to normal again. I went to take a look at the tricky balancing act between safety and studying. Classrooms, lessons and playgrounds are looking very different for the millions of pupils returning to school this academic year. Schools closed their doors for lockdown back in March, except for the children of key workers, and only opened again briefly in June. So the pressure is now on to get children's education back on track after almost 6 months off. Most schools have been staggering the return of year groups to make sure social distancing measures aren't overwhelmed. And the government is hoping that newly introduced virus control systems will help build confidence in teachers, parents and pupils.
The most important thing for safety in dealing with coronavirus throughout the country, whether in schools or elsewhere, is simple things like washing your hands. And that's the advice that we're giving.
To reduce transmission risk, classes are forming bubbles, with teachers moving between lessons where possible. Desks have been spaced out, with all students facing forward and using their own equipment. Corridors have been made one-way systems, and hand sanitizer stations have been set up. For many children, it's been a welcome return, despite the changes.
Lots of good things about being back at school, getting to see my friends and just getting to play with my mates again.
And so far, school attendance has been high across the UK, with parents voicing relief that classes can finally resume.
I think the government's done as much as they could do, and schools have tried their best. It's a very strange situation that we've not been in before. I think a lot of parents are nervous about sending them back to school. I'm a bit nervous, but I know they need to go back. And once they've initially gone back, it's going to be fine. It'll be all like normal again, I'm sure.
But the new rules have also brought some confusion.
We haven't gone into detail about playing in the playground because I don't really know how that's going to work. So we'll just judge when they come home and see how it was.
Government opinions have also remained divided over wearing masks. Secondary school pupils in virus hotspot areas will have to wear them in communal areas, but most schools have been allowed to set their own guidance. Teachers around the country have spent weeks preparing in order to welcome pupils back safely.
The children have been incredible. They've been very, very grown up and responsive. The biggest challenges have been building in time to wash hands before and after break times, before and after they leave the room, and still complete full lessons. So hopefully going forward, it will just become part of people's routine and it will become embedded in daily school life.
While many schools have been quick to adapt, others are struggling with the extra costs of cleaning and social distancing measures, raising concerns over already stretched school budgets and the deep inequalities running through the education sector. But with ministers keen to keep children returning to school over the coming weeks, teachers and parents are doing their best to manage a calm and positive return. Alka, I was so impressed by all these teachers getting all the kids to wash their hands and implement all this social distancing and bubbles. You've got a daughter, haven't you? And she's just gone back to school. How's she finding it all?
Gosh, yes, absolutely. An interesting start to the first day at school. Normally we'd have, Mum, where's my PE kit? This time we had, Mum, where's my mask? Yes. So a different conversation. But interestingly, the conversation after school amongst the children hit social media, hit their WhatsApps and their Snapchats, and a real mixed bag of emotion and feeling, I have to say, from what she told me. Some children asking their friends to please make sure you wear a mask while you're at school because I'm going home to my grandma and I don't want to pass on any infection to her. So clearly some fear there. Others raising debate and wanting to sort of know whether the school bubbles were going to be enough to stop the spread of infection, and others feeling sort of very relaxed. So I think, you know, a real sort of mixture of emotion and feeling returning to school amongst the children.
And as a doctor and a parent, what are your general thoughts about children going back to school? Do you feel like the government's done enough, that it's safe?
I think as a parent, for me, it feels really important that our children are given their childhoods. That's where growth happens, and a lot of that growth and that development, emotional, physical, mental, all occurs at school in those social groups. And I think it's really important that our children are afforded all those possibilities. And certainly, you know, for my daughter, watching her growth has been my secret pleasure. So that's as a parent. But I think as a doctor, I'm feeling more cautious for sure, because September, we know, is a time that infections increase anyway, largely viral infections. We see a big surge in schools, passed amongst children, brought home to households. So, and now we've obviously got COVID in the mix. So a little bit more caution from me as a doctor. So quite mixed emotion, really.
Yeah, and be interesting to see what happens during these coming months. Thank you, Alka. Well, the start of a new school year can be a time for many of us, not just kids, to take a look ahead at our goals. And what better time than now to start focusing on our health and well-being? But with budgets tight, what's the best way to keep your body, your mind, and your bank balance feeling healthy? Well, one man who knows all about savvy savings hacks is the self-proclaimed coupon kid, Jordan Cox, who is in the studio with us now. Well, Jordan, few people know how to get as good of a deal as you. How important is healthy eating and exercise for you?
Well, for a while it wasn't at all. I love my takeaways and my fast food as much as every other man. But I actually had quite a bit of a health scare about 2 or 3 years ago. So it forced me to start eating more healthily, thinking about what I'm putting into my body. And I've completely changed. I now love eating healthily. And I've actually, since gyms have reopened, I've started going to the gym. And for anyone that knows me, I don't even like getting out of my seat rather than going to a gym. So it's, yeah, a big change for me.
And UK gyms, of course, that's $1 billion industry. Do you think we're getting our money's worth on those gym subscriptions?
Well, only if you're going to use it, because a lot of people do sign up. They think, oh yeah, new year, new me, sign up, and now they're paying £20 a month and they're not going, and they're locked in. So only if you're actually going to use a gym is it actually worth signing up to it. But one thing you can do is you can sign up for gym-free passes. And a lot of gyms do this, not as many at the moment, but keep a lookout, where you can just go in for 1 day, some are 3 days, some are a whole week, where you can just try out the equipment free of charge. You don't have to sign up for anything. and then you can see if you'll like it. So one at the moment is Anytime Fitness. If you just go onto their website, find your local gym, you can sign up for a free pass, usually between 1 and 3 days. Q Hotels is also the same, so if you've got one near you, you just go onto their website, you can get a free pass, so you can go and try out all the equipment. And also if you've got any friends that go to a gym, if they pay a monthly membership, a lot of them do guest passes, so you can tag along with one of your friends. Sometimes it's once a month, sometimes it's up to 5 a month, depending on who they gym with. So you can actually go in for free and exercise for free. And one more tip is, if you've got any gym near you that you maybe want to try out, why not just go to the reception, ask the manager to see if they've got any free passes where you can go in for a day, try it for a week without actually signing up to anything. Because the last thing you want is to be spending hundreds of pounds of money and not using it.
Yeah, absolutely. And Alco, have you made it back to the gym? I feel like I've been using loads of this online gym content.
Yeah, absolutely. I'm still hesitant about the gym. I think the gym at home, the gym in the outdoors is a really great alternative at the moment.
Yeah, tell us about outdoor gyms, because you've got some ideas on that as well, haven't you, Jordan?
So these are popping up all over the place now, and they're great. So in like different community centres, in parks, you'll see outdoor gyms where you've got different gym equipment like leg presses, chest presses, you've got elliptical machines, and you can go and use them. They're totally free. If you look on 2 different websites, so the Great Outdoor Gym Company and Fresh Air Fitness, they've got maps on there, so you can put in your postcode and find the closest one to you. And you can use all the equipment for completely free. It saves you hundreds on gym membership a year if you just keep going back there. And you can use it while it's still light outside. If you finish work, you can go there and use it. It is quite a bit strange because quite often they're in public parks, usually with like kids equipment as well. So you might see a swing set, a roundabout, and then leg presses. But if you can get over that, then it's a great way to save money.
Yeah, that's a really good idea. And starting to see people again as we come out of lockdown. Well, we always talk a lot about healthy eating here on the Good Health Show, but that can be expensive, can't it, Alco, if you're trying to buy a lot of fresh ingredients? What about healthy eating on a budget?
So one of my favourite apps at the moment is called Green Gin, and it's a cashback app where you get money off your supermarket shopping but on healthy food. So it's like digital coupons on your phone.
Oh, that's good.
And at the moment there's 50p off oranges, 50p off plums, there's asparagus on there, there's cabbage. And if you see anything you want, you go into the supermarket and buy what it was promoting. And then you take a picture of the receipt to prove you've bought it, and then they give you the money back as cashback. So it's a digital coupon, and once you've earned £1.50 worth, you can withdraw it as PayPal money. So it's a great way to save money, and it's all healthy food, and the offers rotate every single week. So every single week you can plan your meals around what you can get on offer.
Oh, that's great.
That's just the initiative that we actually need, is that incentivisation to eat fresh, to eat whole food is really, really important. And to just see supermarkets now doing that is absolutely fantastic. It's a great app to have a look at.
Absolutely.
Yeah, I feel like a lot of people are quite nervous about coming to their doctor about nutrition requests. You sort of think, maybe that's not something I'd talk to my GP about, but do you give people advice on that?
Oh gosh, absolutely. You know, absolutely every mouthful we put in our mouths has an impact on our health. So we have to start again having those conversations as well. And again, be open with your GP about what you might have read or what you might have heard about. And we can certainly help you navigate through what is sometimes a lot of noise in the healthy eating world, isn't there?
And really sadly, Eat Out to Help Out is now over. I love that scheme. But Jordan, have you got some ideas about how people can cook maybe restaurant standard meals, but still on a budget? I always feel quite nervous about trying to branch out.
Oh, absolutely. Well, I absolutely love to Eat Out to Help Out, but now prices have gone back up. You can be paying, gosh, £10 per plate. Even if you get microwave meals from the supermarket, that's still £2-3 just for something you can whip up yourself.
Yeah, it really adds up.
So I've been looking at ways that you can make your own food on a budget, and I found a couple of recipe ideas, all of which you can pick up the recipe, the ingredients from Aldi supermarkets, and it can add up to 46p per head for a plate.
Whoa, that's amazing.
So the first one is a tuna pasta bake, which is 46p per head for a family of 4. You pick up tuna chunks, the pasta bake sauce, and the actual pasta itself. It comes to £1.86, which is 46p a head, which is absolutely amazing value. And then the other one is a chicken stir fry, all from Aldi as well. You pick up the chicken, you pick up the sauce, which is only 29p, which is a really good deal. There's the egg noodles, which is 45p, and then a large stir fry bag of vegetables. That comes to £3.58, which is about 90p a head. When you think if you go to the Chinese takeaway, you're spending at least sort of £4 or £5 just for that in itself. So it's a great way to eat healthy because you know what's going into it, and you can save money on it as well.
Thank you. So many great tips there. I'm going to be downloading some of those. Well, sadly, that's all that we've got time for today. Thank you to all of my guests, Dr. Alka Patel, Genevieve Edwards, Claire Willamant, Karen Piotra and Jordan Cox. I'll be back with you again next week while Jess is on holiday, so make sure to tune in to another episode of The Good Health Show. Goodbye.